Hey guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I'm a physician assistant, former CMP examiner, and U.S. Army veteran. I wanted to come on today and talk about a topic that affects a lot of male veterans, and that is erectile dysfunction. So I know that this is something that affects way more veterans than actually report, right? I know as a previous active duty medical provider, I had a lot of service members that had the disability while on active duty. I've had a lot of patients post-service in my clinical capacity. And I know it's a very difficult thing to discuss, and a lot of men just don't want to talk about it. They don't want to verbalize it, say it out loud, talk to their healthcare provider about it. And it's a really tough topic, right? Women also have female sexual arousal disorder. I'm going to do a video on that coming up here in the future, but it's just a sensitive topic. And, as a healthcare provider, I'm not in the capacity of a healthcare provider here today, but previously in my capacity as a healthcare provider, I always found it just super frustrating because I think so much can be done for people that suffer from these ailments. And it's just so hard to get over that and to talk to your provider about it. So I encourage you guys, if you're suffering from that, to just, even if you got to write it down on a piece of paper and hand it to them for them to read because you just don't want to bring it up. It's something that's super important and can be changed by just talking to your healthcare provider about it. So, I want to again mention that I'm not giving any medical advice today. I'm not giving any claims advice. I'm not a veteran service officer or an accredited claims agent. I don't assist veterans with the filing process in any way. I just review medical records and write medical opinions as needed from time to time for veterans, okay? These types of reports are never required. You can often get them from your primary care doctor. The VA will also give you a medical opinion when you go for a CMP exam if you apply for benefits. So anyways, back to the disorder, erectile dysfunction. So a lot of veterans suffer from this due to incidents that happen on active duty or related to other disabilities that they might be service connected for. So an example would be if you had blunt trauma to, your pelvic region while you're on active duty. Let's say you had an IED blast, or you had a gunshot wound in the area. You could potentially have issues related to erectile function just from the trauma that happened in the area, okay? You can also have secondary, you can have erectile dysfunction due to psychiatric issues that you sustained while psychological trauma from active duty, medications that you possibly use to treat those ailments. A lot of medications known as SSRIs that are used in the treatment of depression, anxiety, and PTSD have known side effects to cause these disorders, okay? So it's very common for people to suffer from this. And it's very common to see people get service connected for it, right? But it's very important to be able to show, A, that you have a medical condition that's been diagnosed, right? And B, that you have to show how it's related to your service, okay? And that's kind of what we're talking about. So that blunt force trauma or some type of trauma that happens to the area. Let's say you had, another thing would be like if you had a hernia repair. Sometimes the nerves that are in that area can be affected if you've had a hernia repair, inguinal hernia repair on active duty. We talked about some different medications that can affect it. We talked about, here's another thing, right? So back pain. If you've got back pain, a lot of times people will say, just any joint pain can cause them to have some, decreased, I don't want to say decreased libido, but maybe they've got increased pain while they're having sex, right? If you have nerves that have been affected due to nerve impingement, right? You have a bulging disc in a specific area. It's really towards the bottom of your spine. There's a specific area that can innervate or feed nerve-wise that area. And if those nerves have been disrupted, then you can sometimes have dysfunction related to that. Hypertension is another thing. So if you've got high blood pressure can certainly affect those smaller blood vessels, on your hands or, your penis, your lower extremities. Same thing with diabetes. Diabetes is a disease of the small blood vessels, right? So it can start affecting the erectile function. It can affect your vision, right? The small blood vessels in your eyes, and things like that. So there are a lot of secondary things that can, if you're service connected for blood pressure, diabetes, a mental health condition perhaps, and you develop, erectile dysfunction, this can be related. Did you have prostate cancer? Someone that has prostate cancer related to Agent Orange exposure perhaps might have this going on. And it's important to note that this is, and again, I'm not the ratings expert, but it's pretty common knowledge that this is an extra schedular rating, right? Related to loss of use of creative organ, right? So special monthly compensation. So what does that mean? That means even if you're 100% disabled, right? And you are service connected for this, you may be entitled to extra payment on top of your regular scheduled disability. It's usually somewhere, I think it's up to about $110 a month, right? So that's not factored into your regular ratings. Again, you want to check with your VSO to get clarification on this. But it is definitely something that many veterans get rated for. So I think I'm looking over my little notes here to make sure we kind of covered a lot of the conditions. Now, this is not a comprehensive list of the conditions that can cause the disorder. There's also many other things that, many veterans suffer from that can be related to erectile dysfunction. So lastly, I wanted to go over the Disability Benefit Questionnaire, or the DBQ, that is often performed at the CMP exam for this. So a lot of veterans will ask, well, what happens on the exam for ED when I go in for the exam? So I did a lot of these exams when I was a CMP examiner. One of the biggest things that gentlemen worry about is, are they going to have an examination of their genitals, right? So not always, right? You can decline an exam. You don't have to have an examination. In fact, most of the time when I review records, most of the time veterans do decline it. Now that can, not being able to visualize the area may or may not impact your rating. And I'm going to go over that too. So, but first, the DBQ itself, I'm going to just flip my camera around and show you guys. Okay, so the top page is, male reproductive organ. You can get this right off the va.gov. You can take it to your treating provider. They can fill it out for you, or you can have one done at the VA when you go for your CMP exam, right? Or your VA provider, you can ask them to fill it out too. So this first page just really asks about who's completing it. So it's for the doctor to fill out who they are. Were they your treating doctor? Did they review your records? What did they review if they did? And then down here, it asks, have you ever been diagnosed with any condition of the male reproductive system? Yes or no? And then here you can see erectile dysfunction is at the top. There's other conditions that are done on this form as well. So penile deformity related to Peyronie's or another disorder, testicular removal, maybe if you had cancer or something. Testicular atrophy, maybe due to low testosterone or something like that, epididymitis, prostate gland injuries, neoplasms of the male reproductive system. So it's asking basically in that section, what is the medical condition that you have, right? So we're talking about erectile dysfunction. So they would check erectile dysfunction if you in fact have that, rate the pertaining code and the date of diagnosis. They would describe the history down here in 2A. So, it started 20 years ago. It started after I started taking my, whatever medication for my mental health condition. Then it asks here in 2B, does the veterans treatment plan include taking medications? Yes or no? List them, Viagra, Cialis, or whatever you're taking. Here it asks, have you had an orchiectomy, which is related to the testicles, right? Have you had a testicle removed? Why? Is there renal dysfunction due to the condition? Do you have kidney impairment? Do you have avoiding dysfunction? These are more like, do you have problems with urination, right? These are more not as much related to erectile function as prostate type disorders. But these questions are on here because remember up here, this DBQ is not just for erectile dysfunction, it's for other things. So most of the time with erectile dysfunction, it's pretty quick. It's just that you have if it's uncomplicated, you have the condition, they describe the history. Most of the time, these answers are going to be no, unless you have another comorbid condition. Here's some specific questions on erectile dysfunction. Etiology. So they're asking like, why does the person believe you have it? Is it related to your hypertension? Maybe? Is it related to your medications? And then it specifically asks, are they able to achieve an erection sufficient for penetration and ejaculation without medication? Yes or no? Do you use medications for the treatment? Do they help? Some of these other areas ask about retrograde ejaculation. I rarely have seen this be, most cases don't have this, right? Some do, but most of the cases that are pretty straightforward, that is not part of the condition. This is about epididymitis, which is a separate condition. Now we get to the physical exam. So the person can just, right here you can see it's normal, not examined per veteran's request. You can click that, not examined per veteran's request. Not examined per veteran's request. Veteran reports normal anatomy with no deformity or abnormality. Not examined. So there's just different things they can select, right? So if you don't get your stuff examined, that doesn't mean you're going to get denied. In fact, tons of people don't, defer the examination, right? The testicular exam is the same, epididymis, prostate. Then it's going to ask about cancers. Have you ever had cancers? Most of this is going to be a no, right? Unless that's, what you're going in for, which is not the video we're talking about today. So I'm going to breeze over that. So then it's going to ask about, have you had surgeries? Diagnostic testing. Most of this is not going to really apply to erectile dysfunction. Not always, but most of the time. Does it impact your ability to work? I'll let you guys, comment on that. If you have difficulty with working for some reason, remarks. That's just basically, if they want to write any additional statements about why they believe it's related to your service or anything that might have been missed. Okay. And then they're going to fill out their information, right? So let me flip the camera back around. Okay. So let's talk about, lastly, I want to talk about the actual ratings, right? So, and I have another little cheat sheet. So, most of the time it's going to be 0%, right? If there's no abnormality. So I'm going to just quickly look over here and read it off to you guys because I don't want to miss it. But basically, if you have had more than half of your penis removed, they're going to rate that at the 30% level. If they remove your glans portion of your penis, that's the 20%. If you have a physical deformity that prevents you from being able to get an erection, that can make it be a 20% rating. So if you've had both testicles removed due to service-connected event like cancer or something like that, or a trauma, you get 30%. If only one testicle is removed, they say it's 0%. And so generally speaking, if everything anatomically is normal on the outside, you're probably going to get 0%. But again, you get that special monthly compensation, that extra scheduler, $110 or so a month. So that's pretty much it. Again, these ratings can always change and get updated. So it's always best to follow up with your VSO or your accredited agent to get further information on this. I think this is one of those conditions, especially with mental health related disorders. If you don't have a lot of other risk factors, I think it's a pretty straightforward one. Have I seen it denied before? Yes, I have, because each examiner and rater has a different interpretation of the specifics of the case. No case is the same. But I would think, generally speaking, if you're a pretty otherwise healthy individual, you don't have diabetes, let's say it's related to your PTSD and the medications, and that is the history that you have in your medical records and that you report, I think that's a pretty straightforward connection. So I hope this was helpful to you guys today. Please let me know if you have any questions. And please, if you're suffering from this, there are people out there that can assist, and your medical provider can certainly look into this for you. So I hope that this, along with any other medical condition you have, you're not just suffering from, and you get that stuff checked out by your doc. So thank you for watching, and I hope this was helpful. Thank you.